Thank you. Thank you for allowing me to speak about our study, which focused on school-age outcomes of preterm infants who received antenatal magnesium sulphate therapy. Antenatal magnesium sulphate therapy has been reported to have neuroprotective effects, reduce IVH, reduce cerebral palsy in preterm infants since the 1990s. In 2009, Cochrane Library, which is a meta-analysis of 5 RCTs, showed that in women at risk of preterm birth, it reduced the risk of cerebral palsy in early childhood. Risk ratio was 0.68. But the effect of school-age outcome is still unknown. Our objective is to evaluate the effects of antenatal magnesium therapy on school-age outcomes of preterm infants. We conducted a systematic review and meta-analysis according to the preferred reporting items for systematic reviews and meta-analysis. Please a statement. The protocol was registered on Prospero, which is an international prospective registry of systematic review. Its inclusion criteria. In this study, we constructed the following clinical questions. For women at risk of preterm birth, is antenatal magnesium sulphate therapy better than placebo for school-age outcomes? Study design we adopted is RCT. Primary outcomes was school-age outcomes, cerebral palsy, mental retardation, visual impairment, and hearing impairment, and so on. And secondary outcomes was short-term outcomes of mother and infants until NICU discharge. We searched Medline, Embase, Central, Signal, and any other accessible relevant databases. And 2 reviewers independently assessed the eligibility for inclusion, the risk of bias, and data extraction. We analyzed using Review Manager. We show Prisma flow. 470 studies were identified through database research, and 363 studies were excluded in literature screening. 54 full-text studies were assessed for eligibility, and 49 full-text studies were excluded. 5 studies were included, and we audited 4 studies adopted in Cochrane 2009 because of meta-analysis of short-term outcomes. Finally, 9 studies were included in qualitative synthesis. It included studies. Number 1 to number 4 studies adopted in Cochrane 2009. Number 5 to number 9 studies we selected in this study. 2 studies, number 5 and number 6, included in school-age outcomes. The other 7 studies included short-term outcomes. We show odds ratio and forest plots of school-age outcomes. Antenatal magnesium sulphate therapy had no relation to cerebral palsy, hearing impairment, neurosensory disability, and death. By the way, we defined neurosensory disability as having one or more cerebral palsy, mental retardation, visual and hearing impairment. And we were not able to conduct a meta-analysis the following two items, mental retardation and visual impairment, because the evaluation methods of them was different in the two studies. As for mental retardation, one study reported the presence or absence with mental retardation, and the other reported the score of developmental test. As for visual impairment, one report reported the presence or absence with blindness, the other using glasses. So we were not able to conduct a meta-analysis. We show short-term outcomes. We were able to conduct a new meta-analysis to 7 items. Antenatal magnesium therapy significantly increased any maternal symptom. Odds ratio 18.63. But it was no relation to adverse events newborn any symptom, use of ventilator, use of vasopressor, and respiratory distress syndrome, patent ductus arteriosus, and sepsis. Its discussion about school-age outcomes. Unlike Cochrane 2009, antenatal magnesium sulphate therapy did not reduce the risk of cerebral palsy in school age. Of the 5 RCTs adopted in Cochrane 2009, only 2 RCTs have been reported school age outcomes. And there were no other RCTs on school age outcomes, including new studies. If we find further reports on school age outcomes, and if we conduct an individual participant data meta-analysis, the results might change. About short-term outcomes, the results was not different from previous Cochrane 2009 and an individual participant data meta-analysis 2070. The rate of maternal adverse events was significantly higher in the magnesium groups, but there were no severe maternal adverse events such as maternal death and maternal respiratory arrest. There are some ongoing RCTs of antenatal magnesium sulphate therapy. These studies will provide more firm evidence. Antenatal magnesium sulphate therapy had no influence on school age outcomes of preterm infants. Regarding short-term outcomes, antenatal magnesium sulphate therapy was associated with maternal adverse effects, but not with neonatal symptoms. Thank you for your attention.
Thank you.